we are going to remove the chest wall along with the anterior anterolateral abdominal wall. So we are removing it in this way. So as we remove, we had to cut this part, that was diaphragm, thoracoabdominal diaphragm, which was attaching to the ribs and the seaport process. So it was being cut here, as you can see. Also, we had to cut some ligaments here. This ligament was attached like this here. This is ligamentum teres hepatis, so that was cut. And later we cut the muscles, the anterolateral wall muscles. These muscles are also being cut, and we removed the chest wall along with the anterolateral abdominal wall. Now we will orient ourselves so that we can understand all the organs here. So as I mentioned before, this is thoracoabdominal diaphragm, which is separating thorax from the abdomen. You can see the abdominal organs here. So let's try to locate the organs here. This organ here, this one, this is called liver. And here, this side, we can see this part, that is stomach. And here, this is spleen, this one. Then the stomach will continue as duodenum, that cannot be seen now. Here, this structure here, that is below the liver, this structure here, this greenish area here, this is here gallbladder. Now you can see here this area, this one, this is transverse column, part of large intestine, and these are coils of small intestine. Okay, small intestine will end here in this area. So this part of the small intestine, here this is called ileum. So basically, if you look at the small intestine, this part onto the left and upper part, these coils are jejunum, whereas right and lower part, these are the coils of ileum. The ileum is going to end here, as we can see here. Ileum is ending here in this structure. This is the beginning point of large intestine, that is called cecum. So this is cecum here. So here you can see a small structure which is attached to the cecum, that is called vermiform appendix. Now the cecum is the beginning of large intestine, and it is going to continue as ascending column. Ascending column is reaching somewhere near the liver. From there it is going to continue as this structure here, that is transverse column. So there is a flexure that we can see between the ascending column and the transverse column. This flexure here is called the right colic flexure, that is related to the liver, so it is called hepatic flexure. Now the transverse column, that is going to continue, and here, somewhere here, it is going to continue as the descending column here, So the flexure here, that is between the transverse column and the descending column, that is called the left colic flexure. Left colic flexure is related to the spleen, so it is called splenic flexure, this one. Now as you can see, the descending column, that is going to move downwards, and it is going to continue here, this area, this part. It is going to reach the pelvis. This is the pelvis region where I am putting my hand, pelvis. So it is going to continue in the pelvis. Then you call it as sigmoid column. As you can see here, this is sigmoid column. Sigmoid column is S-shaped. It is also called as pelvic column, and it is going to enter into the pelvis. Then it will continue as rectum, anal canal. And here this side, as we can see, somewhere near this area, here we can see a retroperitoneal organ here, that is right kidney here on this side. Now we will see about the peritoneum. So as you know that the abdominal cavity and the organs are lined by the serous membrane that is called peritoneum. So peritoneum has got two layers. Right now you can see here, this is the parietal layer of the peritoneum, and the peritoneum that is going to lie applied to the viscera here is going to be visceral peritoneum. So basically, as you open the abdominal cavity, this is my hand. My hand is here now. It is in between the parietal peritoneum and the visceral peritoneum. That means my hand is now in the peritoneal cavity. So peritoneal cavity is between the parietal and visceral peritoneum, where you have got a minimal amount of peritoneal fluid. So let's see now here the peritoneal reflection on the anterolateral abdominal wall. So you can see here, so the peritoneum is going to cover the anterolateral abdominal wall, and it makes some folds here. You can see here there is a fold which is located at the center that is moving towards the umbilicus. This fold, so you can see here, this one, okay, this fold that is moving towards the umbilicus from the center. This is called median umbilical fold. So median umbilical fold is a fold of peritoneum that is lying over the urachus. Okay, urachus was a connection from the urinary bladder, up to the umbilicus. That later it gets obliterated. So if this connection is persisting, the urine may escape through the umbilicus. Anyway, so this is the median umbilical fold. Now on either side here as well as here, we can see two folds. These are called as medial umbilical fold. So this is median and these are medial. Medial umbilical folds represents the peritoneal fold over the obliterated umbilical arteries. So obliterated umbilical arteries which are also going towards the umbilicus, so that we can see. Laterally we may expect another fold that's called lateral umbilical fold. These are not exactly going towards the umbilicus, so these goes laterally like this. So these are called lateral umbilical fold. This represents the peritoneal fold over the inferior epigastric vessels. So these were the folds related to the umbilicus. So here medial, two medial, one median. These are related to umbilicus. Now above the umbilicus there is a fold that you can see here, this fold. So this fold, as I told you before, this we have cut it here, from here, this point, from here. So this is again a peritoneal fold which is going towards the umbilicus. So this is called the ligamentum teres hepatis. This represents ligamentum teres hepatis that we can see here also. This represents the obliterated left umbilical vein. I'll talk about this very soon. So right now we are in the peritoneal cavity. We are in the abdominal cavity. So let's see some of the peritoneum that we can see here, peritoneal fold. So here, this is the diaphragm. So we can see a peritoneal fold which is connected to the inferior aspect of the diaphragm. This fold which is connected to the liver, also it is connected to the abdominal wall, anterior abdominal wall. So this fold of peritoneum is called as falciform ligament. So it's a sickle shaped ligament which is connecting the lower aspect of the diaphragm to the liver, and it is also connected to the anterior abdominal wall. So this basically divides the liver into two lobes anatomically, the right lobe and the left lobe. And here the lower aspect of the falciform ligament has got a ligament here, a thickening here. This ligament we already discussed. This is ligamentum teres hepatis, this one. Now you can see a space that is here where I am putting my hand. My hand is now on the left lobe of the liver and below the diaphragm. So this one here, this is called left subphrenic space. Similarly here, you can see my hand is going on to the upper aspect of right lobe of the liver below the diaphragm. This is right subphrenic space. So usually peritoneal folds are connected from one viscera to other viscera. Now you can see this area, this is stomach, now this is liver. So from the visceral surface of the liver, we can see a peritoneal fold, this one, this peritoneal fold. This is actually connecting the liver, and that goes inferiorly, and that is getting attached to the stomach. The stomach has got two curvatures. This is lesser curvature, this one is greater curvature. So you can see this peritoneal fold which is attaching the liver to the lesser curvature of the stomach. Also it extends up to the duodenum. So this peritoneal fold is called as lesser omentum. Lesser omentum. So this is lesser omentum. You can see here. Now we can see here on the right side of the lesser omentum, here you can see it is a free margin. This is called free margin of the lesser omentum, which is seen on the right side. Here I can put my finger here, this finger. Now my finger is going to pass into another part of the peritoneal cavity. This peritoneal cavity here is called as lesser sac. So now my finger is going to the lesser sac. Lesser sac is usually placed behind the stomach. So this part. Okay. So here this epiploic foramen is bounded anteriorly by some structures here which are lying on the right end of lesser omentum. These are hepatic artery proper, hepatic duct, portal vein. Okay. Whereas posteriorly here, if I put my finger here, posterior to my finger there is a structure that is inferior vena cava. Similarly, below the epiploic foramen we can see the first part of duodenum. Above the epiploic foramen it is the liver. So these are the boundaries of epiploic foramen. Epiploic foramen is also called as foramen of Winslow. So remember, foramen of Winslow is a connection between lesser sac and greater sac. Okay, so this is beyond this point, my finger is going towards the lesser sac. Right now my finger is in the greater sac. So you need to know what is exactly greater sac and lesser sac. So peritoneal cavity here can be divided into two parts. Greater sac, which is occupying the large area, that I am putting my finger here, which is nothing but the space that is between parietal and visceral peritoneal. So there is a greater sac. There is another cavity which is nothing but the peritoneal cavity, which is located behind the stomach, that is called lesser sac. So foramen of Winslow is a connection between lesser sac and greater sac. Anyways, now moving towards this area, here you can see this is the greater curvature of the stomach. You can see a peritoneal fold. This one, this is called greater omentum. So greater omentum is like an apron, and this has a lot of blood vessels within it. These blood vessels are called as epiploic vessels. It has fat, it has lymphocytes. So this is something like an apron. This moves from the greater omentum, it moves downwards, it folds on itself, and it goes upwards again to be getting attached to the transverse column. So you can see the transverse column here. Now the transverse column, from there you can see another fold of peritoneum that is attaching the transverse column towards the anterior border of the pancreas. Pancreas is placed deep. So this fold of peritoneum is called as transverse mesocolon. So remember, this is greater omentum and it's attached to the transverse column. From there again a peritoneal fold extend towards the anterior border of pancreas, that is transverse mesocolon. Now greater omentum is known as policeman of the abdominal cavity because it can go and seal if there is a local infection. It can go and seal that area and prevent the spread of infection. That is why it is called as policeman of abdominal cavity. It has got a lot of lymphocytes, so it has a role in immunity as well. Now moving on to the next area, that is intestine. Intestine, you can see here, these intestines are connected to the posterior abdominal wall via a peritoneal fold that is called as mesentery. So mesentery has got two borders, a posterior border which is attached to the posterior abdominal wall, which is obliquely placed, which is almost 6 inches long, whereas there is an anterior border where it is attached to the intestines. So this is mesentery. Again, mesentery has got a lot of blood vessels, nerves, lymphatics, all those things within it. Now, moving on to the next area, that is here, cecum. So cecum, here you can see appendix. Appendix has got a peritoneal fold that is called as mesoappendix. So this part is mesoappendix. Now we can see on the sigmoid colon. So this is sigmoid colon. The sigmoid colon also has a peritoneal fold. That peritoneal fold which is attaching the sigmoid colon to the posterior abdominal wall, that is called as sigmoid mesocolon. Sigmoid mesocolon. Okay. Also we may see here, this is, I mentioned already, this is greater omentum which is attached to the greater curvature of the stomach. There is another fold which is moving from the greater curvature of the stomach, another fold of peritoneum which is attached to the greater curvature of the stomach to the spleen, this one, that is called as gastrosplenic ligament. This one, this is spleen, right? Fine. There is one more peritoneal fold which is attaching spleen to the kidney. So if you look at this, kidneys are placed somewhere here, this area posteriorly. You may expect the kidneys somewhere here. So spleen is attached, the peritoneum that is attaching the spleen to the kidney, that is called as lieno-renal ligament. Okay, fine. Now let's see some space here. This is the space that is seen on the left side of your descending column, that is called as left paracolic gutter, and the space that is seen on the right side of the ascending column, that is called the right paracolic gutter. If you look at it, you can see that if I put my hand into the right paracolic gutter, my hand can go upwards, and now my hand is between the visceral surface of the liver and the peritoneum that is covering the upper aspect of right kidney. So this area here, that is called as hepatorenal pouch. So you can see there is a connection between hepatorenal pouch and the right paracolic gutter, and also it is connected to the right subphrenic space, and also below it is connected to the pelvic cavity. So this structure here that you can see, this one, that is called the urinary bladder. It is a male cadaver, so you can see the urinary bladder. Fine. This is the rectum, this area. So there is a peritoneum that is going to cover the upper surface of the urinary bladder, and it is going to cover into the the rectum. So you can see a pouch there that is called as rectovesical pouch. Right. So here you can see this is the large intestine. Usually large intestine has got a lot of fat deposit here. These fat deposits are called as appendices epiploica. These are appendices epiploica. So in the next session we will see the structures which are lying in the peritoneal fold. Also we will try to expose the organs, and we will study it better. Thank you.